We will now perform one complete study using the updated software. As we arrive at pages which have changed, or as we arrive at pages where there are new features available, I'll quickly describe each feature, how it should be used, and how it affects the current software workflow. So I'm going to start a new study simply by touching the New Study button. I'm going to search for a completed patient rather than type in that information again. I'm going to use this patient that we've called cardionexus. Now you can see it's input the patient name, date of birth, gender automatically. I'm going to scroll over to the next page, and assuming none of the information has changed, we could move on with the study, but before we do that, I'm going to point out on the Contact Information tab, under the comment section, I'm going to make a comment because my subject here is having some back pain, so I'm going to put that the subject is in a seated position due to some back pain. This comment will now also appear on the CardioHealth report. So now I'm going to start the study. I'm going to begin the ultrasound examination. So I'm going to choose the right side to begin scanning this patient's right carotid. I'm going to first find the carotid in a cross-sectional orientation as we've always done, starting low at the base of the neck, sweeping up through the anatomy, through the bulb, through the bifurcation, and sweep as much of it as I can. Now, if the operator suspects there to be some lumen encroachment here, or there's some image artifact in the center of the lumen, we can easily assist the operator now by enabling the color features. As you can see, I've turned on the power button here, which enables the color flow or the color Doppler to be presented. As I sweep through the anatomy, you can now see that with each blood pulse, we get a burst of color, in this case orange, filling the entire lumen of the artery. In cases where there were to be plaque present, you would not see the entire lumen be filled, and you would see a small section of dark area where there was no flow, indicative of some lumen obstruction. So you can continue on with the normal process of freezing an image, and now you can save multiple images. I'll also go into that feature a bit more here. So by clicking the Image Save button, the CardioHealth Station now has captured that image. I can go to now unfreeze, find a different segment of the anatomy. I'm going to disable the color feature. So I'm going to locate the bulb. I'm going to press the freeze button in the bulb, and I'm going to save this image. As you'll notice, we now have, rather than 60 frames, we now have up to 256 frames of a video loop, if that much data is available. So it was kind of building the video as we were continuing. When I pressed the freeze button, it only had captured 209 images. If I had allowed it more time, it would have captured the entire 256 frames that are allowed. Now that we have the ability to do multiple images, you may also consider taking longitudinal images, as you have the artery now across the screen in a longitudinal orientation. You may consider saving these longitudinal images as further evidence of plaque presence or absence. So I'm going to continue that by pressing the Save button. I'm going to unfreeze the ultrasound. Now I'm going to enable the color Doppler feature in this longitudinal mode. Again, you can see a visual representation of blood flow as shown by this orange color, pulsing with each heartbeat. And I'm going to again freeze the image. You have the ability then to scroll back through that video loop, finding a better representation or a better image to give you better evidence of plaque presence or absence. And then I'm going to press the Save button to capture that image. Again, you can capture as many pictures as you like on this plaque scan. Up to 30 can be captured per side, a total of 60 images per patient under this plaque scan mode. Now that we've finished the visual assessment for plaque, I'm going to choose IMT and continue on with this measurement as we normally have. So by clicking IMT, this screen should look fairly familiar. I'm going to find the subject's carotid artery. Now I have it lined up across the screen. I'm going to locate the bulb. As you can see, the bifurcation area on the left of the screen, and the system will capture IMT. Okay, now that we have an IMT measurement, what we've done is captured an IMT measurement on the lateral view as we've been used to. I'm going to save this image, and now that we have the option to look at multiple angles, I'm also going to do a posterior view of this anatomy. So you can now see the guide has shifted back here to the right. I'm going to unfreeze the ultrasound. I'm going to place the probe on the neck, tilt the probe to match that posterior angle, find the artery as you normally would, and then capture an IMT measurement at this angle. Now you can notice I was slightly outside of that, but still within that posterior view. In addition to having the option of now doing multiple angles, related to this angle tool, you'll also see a numerical representation of the probe angle listed in degrees. This number is also going to be displayed on the report, which provides the reviewer additional information to judge serial measurements as far as their reproducibility is concerned. So I've now captured two images, one at the lateral view, one at the posterior view. I'm going to save this posterior image, and you can continue on collecting up to 8 IMT measurements. Again, these are still going to be far wall common carotid IMT measurements, 8 per side. The CardioHealth Station will then reference the largest measurement of IMT for the data analysis on the report. Now that we've finished the IMT measurement on the subject's right side, I'm going to move on to the left side IMT measurement. I'm going to reset the angle measurement into the lateral view and just capture one angle image for this demonstration. I'm going to locate the artery, rotate the probe to set the angle, find the artery, and then the CardioHealth Station, as you can see, has captured the IMT measurement. Now, rather than just stopping there, I'm going to show you the usefulness for the two buttons that are displayed on the screen here. As you can see right now, they are both enabled. They're both lit by this blue color. You can enable or disable auto freeze, enable or disable the auto ROI. In some instances where the subject's artery is very pulsatile, or when there's a vein higher up in the screen, or the subject has a very deep artery, you may find the region of interest to bounce up and down and never stay focused on the far wall of the vessel. In order to disable that feature, in the past we've always touched the region of interest and moved it up or down to leave it and let it focus only in one spot. You'll see that when you do that, the auto ROI feature is permanently, or temporarily I should say, disabled. The system will go on to make IMT measurements with the auto ROI disabled, but the user has to then tell the machine where to focus. When that is enabled, which it usually is by default, the CardioHealth Station will track by itself the far wall of the common carotid, as you can see. The ability to disable the auto ROI can either be performed by touching and sliding the ROI vertically or touching the auto ROI button. The user also has the ability to then disable auto freeze. This is not generally recommended because, as you can see here, it's a good stable image, a good stable view, but the CardioHealth Station will never capture that IMT because the auto freeze feature has been disabled. I'm simply going to enable that again by touching the button, and you can see within a few cardiac cycles the CardioHealth Station will capture, as it has just done, the IMT measurements. So that just covers these two buttons, and that we've moved them to the front of the ultrasound page just to help change some settings real time during the IMT scan. I'm now going to go back to the study menu since I've completed all 4 images, and I'm going to quickly talk through this image review button that is also newly added to this CardioHealth Station software. You'll notice that we have captured multiple images, several in each pane. With this image review feature, you can then go back and review individual images. You can see I've captured 3 pages of pictures. I can go back to the second page and then further back to the first page. So you can see I've got a left plaque scan cross-sectional view with color. I've got a left plaque scan cross-sectional view without color. I've got a left plaque scan longitudinal view without and with color. We captured then several other images. I've got a right plaque scan with and without color, right plaque scan in a longitudinal mode with and without color. And then if we continue on, you can now see the IMT measurements. Right IMT at the lateral angle, right IMT at a posterior angle, and then the left IMT at the lateral angle. You can review individual images 4 up as we have here. By double tapping an image, you can review it 1 up, and you can use these swipe gestures to swipe through all of the data, reviewing individual images 1 at a time. You can get out from this view by touching the close button on the top right when you're brought back to the 4 up screen, and then touching study menu will then bring you back to the main page. If you are unhappy with some of the pictures that you've captured, or if you decide you don't need them, you can discard them simply by highlighting an image and then pressing the delete button and then confirming that deletion. And you'll notice that it is now removed from the view here. So I'm going to go back to the study menu. You can continue on reviewing images and capturing more. Again, you can do up to 30 per side on the plaque mode, and you can do up to 8 per side on the IMT mode. Now that we've disabled the traditional risk factor calculator, you will not see the asterisk next to fields which were required when that calculator was enabled. Similarly, on the blood pressure, you will not see these fields required. When we go to the report, you will first be presented with the second page of the CardioHealth Station report, which are just specific to IMT because that traditional risk factor calculator was disabled. If we review the first page, you'll notice the top section of the report here is blank. However, the IMT percentile information is still presented. So you will have the IMT assessment and the plaque assessment as you normally would. However, the traditional risk factor portion is going to be left empty. On the carotid page, I'm going to discuss how to change these images if you are unhappy with them. Let's say you would have liked to have seen a cross-sectional image here. Now that we've captured multiple images under that right plaque scan view, the image select button is also presented here. So by touching that, you can see these tiles representing, this tile says RI, that's right IMT, and LI, left IMT. I'm going to go back to find the tile marked RP. This one here, this is the image that the CardioHealth Station has chosen to use as the right plaque image. I'm going to make the CardioHealth Station use this cross-sectional image, so all I did was touch the RP tile, it removes it, and then simply by touching another image, you can now see the CardioHealth Station has reassigned this picture to be used for the right plaque assessment. Going back to the report, you will now see the image has changed from the longitudinal to a cross-sectional orientation. This just allows the user to present pictures which are more applicable or more easy to interpret per that office's workflow. The same thing can be done with images on the left side. You can choose the image select button, disable or enable, disable and then enable whichever image you would like to use for left plaque and left IMT respectively. You'll also see a button on the bottom of the report for graph info. If, for instance, you wanted to change this table from MESA to CAPS, normally you would have to go back to the control panel and make the change from that point. Here you can just choose the graph info button and then pick whichever table is most applicable for that patient. Let's say you wanted to look at the ERIC set. You would then need to specify which table in the ERIC database to use, which race to use. By pressing the Save button, the report will automatically generate with that table which was selected, so you can see the table has changed and the percentile values have also changed. This allows physicians to use any table